Welcome to MasterMined, the behavioral health business podcast. We go beyond the clinical to explore what it really takes to build, grow, and lead a successful behavioral health organization. Each episode features candid, practical conversations with industry leaders, offering strategies to scale your business while staying true to your mission. From branding and marketing to leadership, culture, and compliance, we cover the tools you need to balance care and commerce with confidence. MasterMined is brought to you by Snapshot, a digital agency on a mission to serve with heart, execute with excellence, and build something bigger together. And now, welcome to MasterMined.
Thanks for joining this episode of MasterMined. Today we'll be talking to one of our good friends over at Cumberland Heights, Nick Hayes. Cumberland Heights is a nationally recognized nonprofit addiction treatment center formed in 1966, and they're based here in Nashville, Tennessee. Nick is all about data, which is what we'll be discussing today, as well as digital advertising and the work he's been doing with Google and how we're monitoring trademark issues. Nick, welcome to the show. It's great to have you on here today, buddy. And hey, I know you and Lee are gonna kick off the data conversation, but just maybe even before we get to that, it'd be great to have the audience know a little bit more about you and kind of your journey, what got you here.
Do we have enough time?
Well,
yeah, no kidding. I can be long-winded, but I'm happy to share. First of all, I just want to thank you guys for having me. I got a lot of love for you, Mark, and I have a little love for Lee. No, I'm kidding. I have a great amount of respect for Snapshot and the work that we've been able to do together for a long time, and how you guys support treatment centers all across the country. So my name's Nick Hayes. I work as the Chief Science Officer at Cumberland Heights Foundation, which means a lot of different things. Maybe Lee and I will get into that, but how did I get into this work is really I fell into this work. I'm a person in recovery, and I'm actually an alumni of Cumberland Heights, so I was first introduced to this world as a patient, as a 20-year-old college dropout, who found Cumberland Heights on Google and luckily made it to Nashville, Tennessee. And look, the place just introduced me to a new way of life and a recovery paradigm that still serves me today, 15 years.
Wow, congrats.
I kind of poke at my boss, Jay Crossan, a little bit just in terms of how I made it back to Cumberland Heights, because it was not my original plan. I made it back to school and ended up getting 3 degrees, and a lot of that was around psychology and therapy. I mean, I'm a licensed trained clinician, and so I thought that my world was going to be maybe being a professor and being a clinician, whether that was in private practice or working in an addiction treatment center. And research found me and manipulated me into a whole other trajectory. So, yeah.
What you do is just got to be so rewarding. And maybe just tell us a little bit about what inspires you to stay with it? Like, what motivates you to show up every day?
Yeah, it matters. That's what motivates me. On average, every single day, there's, let's just say, 7, 8, 9, maybe 10 families that are driving onto one of our properties every single day. And think about the mindset that they're in. They're confused, they're scared, they are angry, lost, looking for a solution, looking to regain what's been lost. And so it matters. Everything speaks. It matters how we greet people. It matters the programs and the treatments that we provide to folks so that they can have a chance at recovery. I mean, that's what gets me motivated. And then I have a great team of people. We have a lot of fun. I mean, the things that I am involved in at Cumberland Heights is essentially anything that has something to do with data. So we have a research institute that maybe we'll talk about. I manage marketing, IT, development IT, quality management, and medical records. So every day is different. I really enjoy that too. And we're constantly solving problems. How can we better serve people that are choosing Cumberland Heights for care, but nothing will change the way that you feel day to day than going and sending over in admissions and seeing somebody walk in for the very first time, hoping that maybe this time something might change. Wow. You don't even have to believe it, really. you might not be convinced at all, but just keep putting one foot in front of the other. So, yeah,
Nick.
I'm super lucky actually to be working in this field and to have friends like y'all and to work for a place like Cumberland Heights. I feel an immense amount of honor to serve that community.
Well, it's just inspiring to see beyond the data, and you're an expert in that, how much you just care about what you do and the people you serve, and about Cumberland Heights. I know it's a part of your blood, and so it's exciting to have you talk about even switching from this to going to data. But it's an inspiring story, and thanks for sharing that.
Yeah,
to kick
for
us
sure.
off.
For sure.
Lee, I'll turn it over to you, man, if you want to start firing some data questions.
Yeah, just quickly, I mean, when Jay reached out to me a few years ago and invited me to breakfast at the Loveless Cafe, I never turned down the Loveless Cafe. And when we got engaged, he said, "Oh, I can't wait to introduce you to Nick Hayes, our Chief Science Officer." I said, "Ooh, Chief Science Officer." I said, "This is amazing." People sometimes will say, "Oh, well, Lee's the internet guy, he's the web guy." But I always tell them, well, I'm really just the data guy. I'm looking at the data and trying to make objective decisions. And now here's the real data guy.
Yeah.
And I was so impressed when I showed up to Cumberland Heights that first time and met with you, just to see all the things that you're doing. And it all started kind of with the Research Institute and kind of has now touched so many departments, right? And then when you extrapolate it, the thousands of lives that success that you've had in research and documentation is now, you're bearing those fruits,
Mm-hmm. Yeah, it's been a fun journey. I've been at Cumberland since it's almost 7 years, so since 2018. And I was fresh out of my PhD program, and Jay Crossan, who we mentioned, our CEO, hired me. And I really started on an island in terms of I was just focused on research. In the organization, I mean, shout out to a nonprofit provider for making the investment, literally, to hire somebody to look at data to try to better understand how our treatments are affecting patients over time. I mean, that's an investment that not everybody can afford. And that current iteration of our leadership team at the time and board of directors were very interested, almost had the attitude of, if we don't do this, who will for us, and we were trying to better understand what our outcomes were. We talk about that all the time. What are your outcomes? Or something that we're still focused on, which is how can we prevent treatment failure, right? How can we keep people engaged long enough for them to receive the right dosage of treatment that we know might decrease their odds of relapse in the future? And then Lee's right. Once I kind of sunk my teeth into it a little bit, you started recognizing that everything by way of data is connected. There's a lot of synergy. So, bear with me, but in academia, research is very cross-sectional. It's very separated. But in a learning healthcare network, everything's connected. So if you can situate a research institute with your quality teams and your IT teams, all of a sudden how you're mining information from the medical record or the CRM or the phone system or Google, the list starts to grow. You can start to combine these data sources in unique ways that can not only help unlock outcomes, but helps unlock business intelligence so that our organization can make informed treatment and business decisions at the same time. And that's where it started to get really, really fun. Like Lee has mentioned, and of course we've collaborated for a number of years in terms of how we visualize information or how we codify our continuum. We talk about that a lot so that we can feed that into our clinical teams and they can make adjustments in real time to patient care. So, but I gotta say, I've never seen a patient at Cumberland Heights, I've never ran a group. I've been a patient, and I've sat in groups, but I just want to shout out to the approximately 315 people other people that work at Cumberland Heights and that are providing care on the front lines. My team served the servers, and we take that seriously and we're super grateful for our role, but there's a lot of people back at the farm down River Road that are meeting with folks on their first day, and I want to honor them and the work that they do to help people change.
Well, that's a great story. And, one of the things that I take away from that initial question is that when you got started, now, 7 years later, you have a very advanced business intelligence solution, and you are really pulling a lot of data. Talk about pivot tables. I mean, you've got a lot of great data that you can now make some decisions on, but you didn't have that 7 years ago. Mm-hmm. And I'm always fascinated how people let the lack of the Cadillac of BI systems be the reason why they won't start this process. And like, how do we get the smaller mom and pops, owner founders to just say, listen, let's don't let perfect be the enemy of good here. Let's start tracking, because you and I have heard everybody claims outcome data, evidence-based treatment, but then when you drill down, they really don't have the research. But you've got to start somewhere. And it's okay to start with a very basic set, isn't it? And then you build it over time like you've done.
Yeah, I mean, I think that's a really good point, because it seems, again, like a luxury that no one can afford. I mean, got to think about the hardware, the actual physical server, the software, SQL. You got to have expert staff, that development that can create and build APIs and pull the data down. Then you have to have the data scientists that can wrangle that information. Then you better have some good leadership that can be a bridge, because what happens is your organization turns into Burger King, where everybody wants it their way. You know what I mean? And so you have to have somebody that's able to sit with the technology teams and sit with leadership, clinical directors, clinicians, everybody that's hungry for information, and be able to effectively prioritize so that you're able to succeed. You got to have a strategy. And when you think about all that, if you were CEO of an organization, you say, you know what? I think that we're okay right now, right? Because that just turned into a 7-figure investment. We can't do that right now. So the way that we started at Cumberland Heights was, of course, through research on the back of measurement-based care, which is the process of measuring change within treatment. And after that, we focused on business intelligence. But here's how simple it started, with a legal pad. Literally. I know people are like, wait, on paper? Because we were kind of the champions of eliminating paper at all costs. But what we did was the organization had to be willing to slow down long enough for us to kind of inventory the business intelligence questions that we wanted to answer automatically or dynamically. And so really where that starts is with census. How many people were here last night? And then, well, what was their demographic makeup? How many were male? How many were female? How many identify as black? How many identify as white? Whatever. What's their numeric age? I mean, you start to really, the simple stuff, checking that off the list, and then you get into what I call treatment dosage, which is level of care by length of stay, right? How many days did they spend in each level of care? And you kind of try to pull that down from the medical records. So you're sort of building a freeway of data, one data point at a time. And again, the key is that you have teams of people that are around you, and the organization supports you in a way that they understand that it's going to be a long process, And so we would meet with teams, and we would say, Lee, Mark, what's important to y'all? What questions do you need answers to for you to do a good job? Whether you're the CFO or the chief clinical officer, and I would just listen. And write. And then later, once we met with lots of stakeholders, we were able to pull out themes, because everybody was really asking the same questions in different ways. Well, that's how it started. I still have that legal pad.
I love that. I mean, Southwest was created on a napkin, right, on a flight. So that's a great story, Nick. I think that, when I get involved with smaller owner-founder companies, and they usually will bring me in, we want to improve our marketing. And one of the first questions I'll ask them, okay, well, what should our keyword stack be in relation to the types of clients that you want? And everything, we want to do all the substances. We want to do alcohol. We want to do all the drugs. We want to do eating disorder. And it's like, well, but what does your data say? Because you probably have success with a subset of that. And instead of trying to bring in all these different clients, maybe you're better at treating, crystal meth, or maybe you're better at the alcohol, and that's okay. But that's where I try to always start. Let the data inform you, like where your success is, instead of trying to cover all your bases. And that's why I love what you just said, because most centers have that data. It's just maybe not in one little, you press one easy button like you've gotten to.
Right.
But there is a way to do it. And I always tell people, don't forget about Excel. There's lots of things you can do with Excel to kind of start building your stack a little bit.
Yeah, and I think that we at Cumberland Heights, the way that so everybody has technology systems that they use to do business in addiction treatment. At Cumberland Heights, we call them the Big Five. So that's your CRM, that's your medical record, that's your finance system, that could be your phone system, and maybe that's your HR system. Let's just start there as an example. And so what Lee's really talking about is that generally what we do is we pull down data manually, and then we try to pivot it manually to try to make sense of it. And what I have learned about technology partners in 2025 is a lot of them are underutilized. So there tend to be, if you have the right partner on board, there tend to be more mature solutions for reporting, more simple solutions that you can lean on with those partners to help you make informed decisions about. Like right now, you're talking about the marketing funnel. So with Google, you and I both know there is too much. The tools that they have in those applications, whether that's GA4 or Google Ads, two distinct properties, if you will, that you can use within Google to manage your business. There is a wealth of knowledge. One of the things that I've learned, I'm just going to keep going for a second.
Please.
Like one of the simple places where you can start with marketing with addiction treatment is reviewing your keywords like Lee is talking about. And I know everybody says that. We're all familiar with what that means. But what I have noticed, especially if you're smaller and you have a small budget, which Cumberland Heights does, like we don't spend a lot of money on advertising, which is a whole other conversation. But what I've noticed is our keyword set was very complicated, was too complicated. And we used other tools. So, for example, it was, I'm trying to think of like how the most absurd query that we were trying to build value on. Like, how do I know if I'm addicted after I've been drinking all night? That's a huge question. What's a very small question? Addiction treatment near me. Now, the competition for addiction treatment near me is going to be much higher, but simplicity is the key. How can you simply improve the value on your GMB, simply improve how your website is optimized for addiction treatment near me, instead of trying to be the master of many, be the master of some? And where we have had a lot of advantage is just pruning back those organic campaigns to get back to the basics. Get back to the basics and focus how we can make sure that our program is discoverable, or the definition of marketing is to be known, so that we are known in our communities around very simple queries.
Yeah, I remember. I don't know if it was you all specifically, but there was one of my clients a few years ago that when we pulled the keyword stack, it was literally thousands of keywords on a very small budget, $5,000 or $10,000 a month.
Yeah.
You can't cover all that, and that's where you start to then see that. I think a lot of times agencies, they need to be directed by the facility. They have to be educated, and because the facility has the data. And I remember this one client, they didn't understand. They had a lot of Alcoholics Anonymous was showing up. Okay, well, those kind of calls are people looking for a meeting, and they kind of get annoyed. Right. If you're trying to talk to them about coming in for treatment when they're looking for a meeting. And so there was these vanity metrics that we end up talking about. And I think what you all have done at Cumberland Heights, especially on the clinical side, you've kind of gotten you've gotten rid of the vanity metrics, and you've really been able to, over 7 years, drill down to what's important, right? And I think that's, kudos to everything that you all are doing. And I think for a lot of centers, like, how do they find the young Dr. Nick Hayes? How do they find the Nick Hayes from 7 years ago, right? That's really another interesting question.
I don't know about that. I'm going to stay away from that question. But what I'll say
I'm not suggesting you start a recruiting agency, but do you have a younger brother?
Yeah. What I'll say is that it's important to have a bridge in your organization. So one thing that I really liked about Lee when he started consulting for Cumberland Heights a number of years ago is I was already neck deep in data. This was 3 years ago, of course, so we were in it. And the next frontier was really codifying our funnel. And so to have somebody like Lee that was able to say, hey, avoid these pitfalls and tackle these issues was really helpful for us to save time. But where I've really seen, we had an organization come and visit us recently to talk about, they're new with their medical record, which is the same record that we use. They wanted to come down and talk about, how can we optimize this tool and simplify it and not over customize it so that we can get what we need to get out of it and we can take advantage of it. One of the things that always comes out of that when I'm talking with other leaders in this space is the importance of having a champion. So like it's also important to have subject matter experts like Snapshot, like a marketing firm like Snapshot, who has the folks that can drive your goals from a creative perspective, organic growth perspective, or paid perspective. That's a given. But it's really important that you have an internal champion, that you don't just rely on your vendors, right? That you have somebody that at the core, like what you did at Foundations, understands the technology of today, understands the goals of the organization, the DNA of the culture, if you will, that can help be that bridge between how are we going to recruit our marketing team to help us increase our ability to reach these goals, as well as with the peers within the organization. Because I got to tell you, when we sit down in budget season and I say, well, we spent X and we were able to do Y, and now I want to spend A so we can get to B, that needs to be more than just an anecdote.
Yeah.
And that requires an ability to not only have an alliance with your teammates, but also to be able to have proved it a little bit. Because an organization like Cumberland Heights, like we're a mission-driven organization. We are not made of money, and we're focused on patient care. Not getting the most calls or generating the most leads. We're just making sure that we are known for people that are seeking care in our communities, and can we do that well? We don't want to get lost in the shuffle, which is very possible these days with some issues that we're seeing. And so it's really important that you have a bridge, because otherwise you're getting that report from your marketing team and you send it up to your CFO and your CEO and they say, I don't understand any of this. Can you explain it? No. Then maybe this isn't worth our time.
Almost every client that I have when I come on site, Nick, they'll talk about their EMR. They'll complain.
Yep.
Oh, we got to replace our EMR. We got to get a new system. Yeah. And it creates this interesting churn when really I think a lot of times the issue is you don't have that internal champion, you don't have an internal administrator, you haven't done the training. A lot of times we think we're just gonna hire,
the problem with
and all of a sudden we don't realize, well, our processes are broken here. Yeah. So they can't, and it's the same thing with digital marketing too. Like we're just going to start running PPC.
Yeah,
it's easy button. And it's like, there's a lot more to it there.
Yeah, it's interesting. And Nick, what I enjoy the most about you guys is you're just so willing to share with what you know, and you built a great reputation around the country of just being a good resource. And just as I'm like, this isn't going to apply to every center, but maybe you talked about those top 5, and maybe if you would just like break down what do you use in those that could be an option for other centers as they're starting to think about integrating some of these tools in, from like your CRM to your marketing automation to your phone system.
Yeah, I'm happy to shout out our friends. So our CRM and our medical record are brought to us by Sunwave.
Okay.
And we've been with Sunwave since the early days, since 2019. Actually, November 4th, 2019. I'll never forget it. Because it was just an immense amount of work to get ready for. We were with Tier, and then we went with Sunwave, and we're in our second contract with Sunwave, which actually I think illustrates our commitment and value we recognize in them. I want to say this about them. This is important to me in terms of a medical record. Do they listen? So it's important. Customer service is really important in terms of how they solve issues for us, but how we solve them collaboratively. Because sometimes when we make requests, we might not understand the development trajectory that they're working on, and So you got to have a really strong alliance with an organization like that, and you need to also be able to have difficult conversations. So Sunwave is our CRM and our medical record. We maintain our own integrations with them. They're very mature. The truth was, when we first started, they weren't as mature. It was a younger company, so it had a younger API. But gosh, over the past 7 years, we get everything that we need when we need it. And we're super happy with how much they have built out by way of that, which is super important because, like you said, not every medical record does the work. There's a difference between the sales meeting, in my humble opinion, and 6 months in when you're trying to work through what was discussed in said sales meeting. So no shade on anybody, but we're super happy with those two products. We also use not for our like business phone system, but for our call center and our marketing and business development, clinical outreach purposes, we use CallRail, which has been a journey for us. I mean, the benefit of an application like CallRail is our ability to track every phone call. And Lee really helped us with this. So the challenge is finding every phone number that's out in the wild. So we have approximately 130, let me back up. Let's just say this. Cumberland Heights has 5 real phone numbers, like in the yellow pages, if you're listening or watching. Old school, like real phone numbers. We have very few. But those exist across Google, Bing, Apple Maps. Don't sleep on Apple Maps. Yelp, our websites.
Directories,
SAMHSA, any kind of print material. Yeah. So like back in the day, before we really got started on this, it was all the same number. So like when anybody would talk about trying to invest in more print material or trying to do this or how many people where are people finding us? Because our front door is digital, and it always will be from now on. And so CallRail is a great tool because it just helps you replicate those numbers very easily, and you can monitor exactly where your calls are coming from, and you can record them. And there's many, many, many other tools. We actually use it as our soft phone, so it's our lead center as well. So folks actually answer the phone within call. Like there's a reporting apparatus I was just talking about. They answer the phone. They're able live chat, forms, all of it in one place, including text, actually. We use Paylocity for our HR system, which we're really happy with. And we use MedHost for our finance system, which we're also really happy with. And we pull down data from those applications and we wrangle it internally, and we display it for our patients through a patient portal that we developed, so that they can see critical pieces of information, maybe like their treatment plan or measurement-based care results in real time. And then we leverage it in our clinical teams in a pretty mature reporting apparatus, and then it kind of goes up. Operations can consume operations information. The CEO can consume that information. Clinical directors can consume what they need to consume. And then, of course, Google. So Google was sort of the last frontier, and we actually use a system whom you're connected with called DataBox.
Okay.
Which I really love. I've really enjoyed working in how easy it is for us to pull in data and visualize our continuum. Our funnel has been it like CallRail. DataBox was plug and play.
Yeah, that's amazing. And I mean, just you talking about like a partnership with Sunwave early on. I can't imagine how much you helped direct how that platform expanded and how it evolved over time, and having that partnership where you can have hard conversations and everybody understands we're just trying to make each other better.
Yeah. I mean, I shout out to them, Ellie and those guys. Like I don't know how much better I made it, but I think that the wisdom that Cumberland Heights holds in terms of how we structure care is what really helps them scale their product. Like, how should group notes function? How should the face sheet function? How should the hierarchy of how you measure treatment? This is a problem that a lot of medical records haven't solved for. I'm not going to name names, so nobody's going to see me at my next conference and I can't believe you said this about us. But like sometimes you should really make sure that you can get the business intelligence you expect out of a medical record. Because often there might be a bifurcation in terms of levels of care and your unique programs. because that's a one-to-many relationship sometimes for programs.
We don't, in those sales meetings, we don't ask them to actually print the face sheet or print the report.
Right.
And when you do that, you all of a sudden catch like, wait a second, why is this not here? Why is this field not? I thought this field would have been here.
Right.
Are you guys also doing billing through Sunwave?
We bill in-house.
Okay. Oh, excellent.
Yeah. We have our own AR team, and we're confident. And we've done that for years and years and years and years. And so we have a really incredible team that manages that process from the front to the back.
Mm-hmm.
Yeah. AI used to be just the buzz, and it was like everybody talked about it. But I guess, just thinking through all these platforms and knowing how tech savvy you are, like where are you seeing like AI in some of this work? Like I know, CallRail has AI incorporated into it, so it can listen to calls and then can serve up, hey, maybe there's a challenge with some of these, call center folks that from a training opportunity standpoint. But, like I'd love to hear from you of like how you're leveraging like some of the AI to incorporate some of this data.
Yeah, it's creeping into Cumberland Heights in multiple angles. So a lot of the applications that we use to provide treatment are starting to increase their offerings. And let's start with email. So we're a Microsoft shop. Like that's our email tenant. Teams and OneDrive and all that, and Copilot and those products are we're not even going to talk about cybersecurity today, but that's a whole other show. I know this tend to be marketing and data focused, but they're rolling out features all the time that are saving people time. Our phone system, like you mentioned, CallRail, has immense amount. One of the things that our team really likes is sentiment analysis, as well as the AI summary, so that as you're reviewing calls over time, you can kind of quickly understand, instead of having to read a 20-minute transcript, you can quickly understand what this call is about when somebody's trying to be coached, etc. Because we do coaching sessions that Lee taught us about and how to do, and people review their own calls with their manager on a regular basis, which is super, super important, which Lee Pepper can help you out with if you need help. But we're seeing it in the medical record. There's a product that Sunwave has called Mara that will help you summarize clinical notes. And that can be helpful for a lot of reasons. I mean, I am a clinician, so I know that this might be controversial, but I was taught that clinical notes and treatment planning was super important. Obviously, for utilization review, that's super important so they can leverage this information with your payers, but that's not what I'm talking about. I'm talking about it's important because it's a rudder. It's a rudder for me clinically to understand where I was with you, Mark, and I can pick that back up appropriately. Mm-hmm. And so Mara can provide some advantages in saving time for clinicians that are really busy, that might have a caseload of, and it's residential care. People are with us for on average 25 some odd days. So we would rather our clinicians be able to document appropriately, have tools that can help them, and also increase their face time with patients. Now, let's get back to the Research Institute. How is AI starting to bleed into what we're doing in terms of research? So in our Research Institute, we're very focused on two big, we have really 4 or 5 big projects that we're focused on all the time, whether that's internal reporting that we do on an annual basis on our homepage. You can check that out. We also have some private engagements. We collaborate with FORCE, the Foundation for Recovery Science and Education, brought to you by NATAP, the analytics engine of that program, and then some other things. But right now, we just launched a new study, grant-funded, a wearable study, which is super interesting. And we're going to be leveraging a lot of AI to make sense of that data, because wearable data, like if you're familiar with Whoop, or I think that's a Garmin or Oura Ring, it's very, it's not like survey research. It's very intensive longitudinal data, and so you actually need AI tools that can help you make sense of what's happening and all of the noise. And so it's a pilot program, it's a pilot study. We're going to introduce research-grade wearables for 2 weeks for 30 residential patients over the next year to try to understand if there's a bifurcation between how somebody's body might be reacting to care and how they're reporting they're reacting to care. Wow. And how can we use that as a tool to make sure that, again, we're preventing treatment failure.
What kind of technology, like when somebody comes into Cumberland Heights, what's the technology for the patient?
Yeah, this is a really interesting balance because I'm the technology guy and I'm the data person, and my teams are too. But I got to say, we ask ourselves hard questions. I just want to say that before I get into it. We ask ourselves hard questions about
it's not a fad,
right?
Yeah,
but also when is there a line? We're constantly asking, is there a line? Are we approaching it? Are we over it to introducing too much technology? Because there is. At the core of what we do is trying to remove barriers, trying to stabilize you, remove barriers for you to be able to access your continuing care plan once you leave treatment and engage in community and learn how to be authentic, genuine, and vulnerable. That's at the core of Cumberland Heights' DNA, so that you can regain what's been lost and maintain recovery, however it is that you define that. With that said, over the past half decade, we have started to use technology more robustly. I've talked about measurement-based care, but another program that Lee's probably talking about is a tablet program. We made it ourselves. We developed it ourselves. I don't recommend that. If you have developers like we do, when I say developers, nobody freak out. We have 2 full-time developers, which is usually 2 more than most programs have. So we're very lucky and very grateful that we have those resources. But I'm not saying we have a 10-person team, but they built really the patient portal from scratch. And so it was another really interesting process to meet with our clinical teams to be like, hey, if we did this, what would be interesting? Every patient, before we got started on this, when the treatment plan was completed, within the first 5 days of care, they would print off the piece of paper and they'd say, here you go, Lee, here's your treatment plan. You'd say, gee, thanks. And likely, because you're 5 days into addiction care, you'd probably go and just leave that in your cabin, Not saying that everybody did that, but I'm just saying, who's going to carry around their treatment plan and flip through it on their next session and be like, hey, are we on intervention 2 or 3?
Totally.
So we started mining that information from the medical record and actually just pushing it to the tablet. So as things change, you can see. Things that people fan favorites, our menu. The weather, speaker tapes, meditations, a library of videos, whether that's internally recorded, psychoeducation groups, all of those type of resources. And the other big one is scheduling. We have 137 beds at our adult residential site. We have approximately 40 beds in our adolescent programs. We have immersion programs, and then we have about 13 IOPs throughout the state. But when we're talking about River Road, our addiction treatment adult program, 130 people, 125 people, that's a lot of people. And so we used to print off a schedule every week and then have it posted everywhere. And so what we've done is made it a bit dynamic because there's these so you get your schedule, and if you have an individual appointment that's just for you, the tablet will ping you and let you know. It's also how we collect data, again, through the tablet, not on paper.
See, I love this because so many of the smaller programs that are not as mature as Cumberland Heights, everything's anecdotal. And what I like about whenever I would engage with you, Nick, and your team, is if you don't know it off the top of your head, I'll go find it.
Yeah.
And that's what I think is it's a superpower that you all have, and it all shows up in the your patient success. And I love that, and I know we're pressed for time, but you guys publish. I love that, every year, the Research Institute publishes the results.
Yeah.
And it's very accessible.
Yeah.
And I think that's something that most programs could probably start at a very basic, and then kind of grow it over time and mature like you all have. But I think there's no excuse for not starting today with some of these basic things that you've mentioned.
Yeah, I think that we do this for 3 reasons. That's to better inform patients and families, better inform them so they can make informed treatment decisions. The second reason, super important, we want to better improve our programs. So you need feedback loops for that. And the third thing is we want to better communicate with external stakeholders. So like Lee was talking about, generally we speak an anecdotal story, like I'm a person in recovery, I have 15 years of recovery. That's really important in certain contexts. But let's just say lawmakers. They speak in the language of peer review. They speak in the language of aggregation and data. So we need to invest in those type of languages so that we can tell the stories we need to tell, so that we can appropriately advocate for our services. And that's really what
payers.
Yeah, for sure. But the annual report was really interesting because it started real nerdy. The first one, which I still have a few copies of, was like, I was just out of school, so I was used to writing in APA format. Shout out, APA. Which like 1-inch margins, Times New Roman, 12-point font, in-text citations. So I wrote a research paper. I wasn't like, I was using the framework that I was familiar with. And so when I published it, like, sure, people were happy with it and all that. But over years, what it's really evolved to is a more public-facing, easier to consume tool. You know, and there are the nerdy nuggets for those that are interested in that. But I agree with you, Lee. Like, no one owns algebra. And so it's important to just tell people, hey, how do we define success? How do we measure that? And then what limitations do we see? So, you know, if you see a treatment center that's claiming some sort of absurd success rate, I would be wary of that. Not only in terms of maybe investing into that assumed success, but also the team that thought it was okay to publish that. I would really question that, you know?
Yeah, when you were talking about the citations, you know, I just have been going through the process of writing, you know, my book that's coming out in September, and that was one of the things that my wife was really giving me a hard time about because, you know, I was spending so much time doing the citations, and in the beginning, I wasn't like keeping up with, you know, my research, and all of a sudden the publisher's like, okay, hey, I need a citation. I'm like, oh, where did I do with that book, and where's that quote, you know? And so it's really, I really appreciate that more now because from the marketing perspective, I'm used to seeing all these outlandish claims, and I'm wondering, where's the citation now for that?
Right.
Well, Nick, before we leave, where will you be later this year? You're going to be speaking or presenting any conferences, and maybe do a plug for your annual Ryman fundraiser.
Yeah, so we're going to have a concert. So we have a few signature events at Cumberland Heights that help us fund patient assistance. We also have a big development campaign going on, but in general, it's patient assistance. So we have it's actually 30 years this year, celebration of Cumberland Heights at the Ryman Auditorium. Shout out to the Ryman. We love that venue, and we love our partnership with them. This year, I'm going to get in so much trouble, but we'll link it in the comments below. Don't worry. But it is in November. I'm not allowed to share. My lips are sealed in terms of who's going to be playing and all of that. But soon that will be announced. And it's always a really good time. You've been to both of y'all.
I can personally say that I never know who's going to be there because you guys do a very good job of keeping it under wraps. And I am always blown away. And I have a really good time because it's so accessible. You know, and it's like a homecoming of sorts, you know, and so I always encourage people to come and have a really, and you hear amazing stories. Like that's the thing. I mean, being in Nashville, you know, we're all used to the singer-songwriters, but it's really amazing the authentic stories that you get from the Ryman because they're really taking the time. It's not a rushed, you know, pre-planned concert package. No, this is really unique.
I appreciate you saying that. I think it's important sometimes to just be grateful, for me to be grateful to celebrate the community. You know, like we're working on an update for our history book. So history is all on my mind right now in terms of Cumberland Heights. And, you know, to think about Cumberland Heights is 60 years old next year. And we're, you know, I'm just a temporary proprietor. You know, I'm a temporary member of the team. And to think about all the folks that have come before us and all the people that are going to come after.
Right.
You know, and when we're at last year, when we were at that Ryman event, to hear all the stories about, well, when I did and when I went and when I met, you know, it's just special. It's special. People matter. You know, last but not least, if it's okay, if you're struggling, you know, if you don't know what to do next, whether that's about yourself or your family, you know, you can reach out to us. One of the things that we talk all the time about is every call finds a home. So if you call us, that doesn't necessarily mean that we're going to make a recommendation for us, but we will find you a place to be, right? We will take care of you. So that's what we do. That's why we're here. That's why this place was founded.
It's amazing, Nick. I mean, we could talk for hours, and I just really appreciate you being on the show and sharing everything you have today with the audience. Is there anything you think that maybe we forgot to ask or anything?
No, I just want to thank you all for your service, Mark and Snapshot and this team that you've built. It really is an amazing behavioral health team that can really help. I mean, what you guys have done for Cumberland Heights, even before, with some commercials in the early days of our partnership. Mm-hmm. I'm grateful. I'm grateful for the type of partnership where whenever I had a concern or wherever I have a question, I know that I can call your cell phone. Hopefully you do that for everybody. But we've got a lot of love for our relationship with Snapshot Creative here in Nashville, Tennessee, and then Lee Pepper. I really mean this genuinely. If you have the chance to reach out to someone like Lee, he's probably not. He's probably going to get mad at me after this, but you should call Lee Pepper. You should call Lee Pepper if you have questions about your technology or your marketing, because Lee will help you. And what I love about you, Lee, is you told us the truth about some things that were maybe difficult to hear at the time, and it really helped us maybe understand the full measure of what we needed to do next. Mm-hmm. So thank you both.
Absolutely.
Yeah,
happy
well,
to be
thanks.
here.
And we'll drop all those tools that you mentioned also in the show notes, so everybody has record of that. I just want to thank you for joining the conversation on this episode of MasterMined. We hope you learned a thing or two from Nick and Lee that you can use in your business. You can find anything we referenced today in this episode's show notes. And as always, reach out if you have any questions or comments. Until next time, MasterMined, signing out.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.